This is Yohannes Ayalew. I'm the HIV Prevention Coordinator at Africans in Partnership Against AIDS, APAA. APAA is a non-profit AIDS service organization located downtown Toronto, 526 Richmond Street East. And we provide HIV education, support, and community development activities for predominantly focusing on African, Caribbean, and Black communities. And we provide different types of opportunities, student placement, and volunteers. So in this Zoom interview, I'm hosting Ken English. He's a senior program consultant of Provincial Programs Branch at the Ministry of Health. And we'll be discussing about HIV self-testing in Canada. And as you might have heard from the news, recently Canada approved HIV self-testing, and we're all new to this concept. And I hope Ken will be walking us through the details of HIV testing, HIV self-testing, of course. And thank you, Ken, for taking the time and joining us for this interview.
Thank you for inviting me, Yohannes. Much appreciated.
You're most welcome. So I will be starting with the first question. What's HIV self-testing?
Yeah. So the HIV self-test is a test that a person can do on themselves in their home without needing a healthcare provider to do the testing for them. The test itself is a small portable test that is very simple to use. Requires a small droplet of blood from your finger. The blood is put into a very small container, and that container produces a result in approximately 1 minute. So it's a very fast test. A person will know whether they are HIV positive or negative, providing they are outside the 3-month HIV window period. So HIV self-testing is really like home pregnancy testing. You do the test yourself, and you obtain the result yourself. The self-test uses the same technology as the HIV rapid point-of-care test, and some people may have experienced that test if they went to a clinic for that kind of testing. And in fact, the self-test has the same accuracy of the rapid point-of-care test. It's important to note that the HIV self-test is considered a screen test for HIV. So what does this mean? It means that all HIV self-test positive results do require confirmatory laboratory testing. So they will require lab testing if the person tests HIV positive with the screen test. So that's not the end of testing if a person tests positive with the self-test. So if the person tests self-test positive, they will definitely need to go either to their doctor or to a clinic, and they should let their healthcare provider, their physician, know that they tested self-test positive and that they need confirmatory testing. So this is very important. We don't want people thinking that if they do the self-test, that is the end of the testing for them. They will need that confirmatory testing for all of their HIV positive results. Now, if the person tests negative on the self-test and they are outside of that HIV 3-month window period, then they are negative for that particular risk incident that they were testing for. They will require no further testing unless, of course, they have another risk incident, and then they should seek testing again. To see how to perform the test, the self-test, I would recommend that folks visit the manufacturer's website, and I can give that to you, that address. It's www.biolytical, BIOLYTICAL.com.
We can send that to our clients or volunteers to the email as well. But
right.
why do we need the HIV self-testing? What is the advantage of it compared as opposed to other types of HIV testing? And then if there are any drawbacks that you can or disadvantages that you can mention. Yeah,
there are definite advantages and disadvantages to HIV self home testing. So in terms of the advantages, obviously HIV self-testing will allow people to get an HIV test whenever they want, whenever they need, rather than making an appointment with a healthcare provider. And this, of course, is especially helpful today, during COVID-19, when there are some limitations around gaining access to testing clinics and other healthcare providers who provide testing. So self-testing will also help people who may not be close to a testing location, or in fact, who may not have a doctor. And lastly, people who would like to test privately will be able to do so, again, in their own home, or do so privately in another space. There are a significant number of advantages to self-testing. And of course, there are, some would say there are some disadvantages. So, if people test alone, they may not be prepared or supported if they get an HIV positive result. And for some people that result is going to be very upsetting, and they won't have that immediate support beside them. And since there may not be any pre and post-test counseling available to a person who does a self-test, they will not be able to have their questions about HIV answered until they have contacted one of the helplines available in the test kit package. So the self-test does have a list of telephone lines to contact for some information. As well, the if somebody tests HIV positive with the self-test, they will need to have that confirmatory lab testing. So if somebody goes to their doctor or a clinic, they will be able to get that laboratory testing right away. In this case, the person will do the self-test, which is a screen test. Then they will need to do that follow-up laboratory testing. So it's kind of a two-step process if they do self-testing. For some people, that's a bit of an disadvantage. And definitely people will need to obtain that important follow-up testing. So they will need that laboratory testing if they self-test positive. Another disadvantage is that self-testing right now is only available for HIV, and yet some people may need testing for other STIs or sexually transmitted infections. If a person thinks that they need both HIV and STI testing, they may then want to consider going to a clinic or to their doctor where they can obtain both the HIV testing and the STI testing. Bottom line, though, is if they do an HIV self-test and they feel they need STI testing, they'll have to do that follow-up with another healthcare provider. So some few disadvantages. But in terms of access, I would say there are significant advantages to self-testing. Yeah.
I mean, in the preliminary discussions we have with community members about this, the major concerns were about the accuracy of the test, and also the missing part of the pre and post counseling. Yeah. So I just want you to comment on those two pieces as well.
Yeah. So I would say that. Sorry, you wanted me to comment on the pre and post test counseling?
And then the accuracy of the test. You already mentioned that, but I just want you to elaborate a little bit about those two.
Yeah, so in terms of the accuracy of the test is produced by the same manufacturer who manufactures the point-of-care test, the rapid point-of-care test. And in fact, it's pretty well the exact same technology. The test looks very, very similar to the point-of-care test, except that instead of somebody, a professional doing a finger prick of your finger, you will do that yourself and put a few droplets of blood into the container and the test technology. So it's very, very, very similar test, and the accuracy is very similar as well. And they are both very, very accurate tests. There may be a few false positives. There may be a few false negatives for people who are still within the window period. And for those people, they should, as I mentioned before, they should test through laboratory testing. So an HIV positive test with the self-test definitely needs a confirmatory test. And in fact, if that self-test has produced a false positive result, the individual will learn that when they get their laboratory test, because it will return negative. And if somebody tests negative, but they're in the window period, we just want to make sure that that test was accurate, the self-test, so we need to ask them to have laboratory testing done. There really is no assurance that a person is negative until they are outside of that 3-month window period.
And people are also concerned about the costs. Is it OHIP covered, or?
Yeah, so right now the test is available through bioanalytical laboratories, through the manufacturer at their website. The test is not quite available for mail out yet, so you can pre-order the test at the bioanalytical website. And the cost of the test is $34.95, and that includes tax and shipping. But again, they're not shipping those tests out until we think sometime in mid to end of December. So they're working on building their e-commerce platform. That's what they call it. There are also 2 studies that are happening in Ontario, and some folks may have heard of those. One is happening through the Ontario HIV Treatment Network, and one is happening through an organization called REACH, a research organization. Both those organizations are distributing test kits as part of their study for free. So that's sort of a limited time period for that. But I will provide you with information that you can share with folks on how to contact both the Ontario HIV Treatment Network about their project, and REACH. That's called REACH, which is operating out of St. Michael's Hospital here in Toronto, about their project. But they will be distributing kits to folks free of charge.
It's the time for COVID. What particular advantage do you see in having the HIV self-test during this COVID time?
So in terms of sort of the impact of COVID and what the situation with self-testing is, yes. So I would say that self-testing certainly offers another choice for people who are seeking HIV testing. In Ontario, people can test for HIV anonymously. They can test using the rapid point of care test, or they can test at their doctor's office. So certainly the self-test will offer more choice, and particularly at this time, in terms of COVID, we initially saw a significant decrease in the availability of HIV testing during the early part of COVID back in March and April. Since then, HIV testing data shows that testing rates have in fact climbed up, back up to the levels that they were in close to the levels that they were in pre-COVID periods, so back in February. Now, it's likely that most of this testing is happening at physicians' offices or walk-in clinics, obviously where laboratory testing is available, and less so at our testing sites that are providing anonymous and a rapid point of care testing. So we would again say that if people are seeking testing, they should firstly contact their physician's office. If they do have a strong desire for anonymous or rapid point of care testing, then they should contact the Ontario Sexual Health Information Line. And I will provide you with that telephone number and web-based contact information so you can share that.
Yeah, thanks for mentioning some of the other options for people to get tested, as well as the newly introduced HIV self-testing, specifically for the communities we are serving, marginalized, African-Caribbean, Black, people from HIV endemic countries. This is going to add more to their choice, right? And how do you think it's going to reduce some of the barriers that people had in terms of getting tested?
Yeah, well, I would say again, I go back to the fact that this is a test that one you can do in the privacy of your home. So if you have a lot of anxiety around HIV testing, then you can do that testing at home, and you can do that you can do that test anonymously. Obviously, if you test HIV positive, then you will need to seek as I mentioned before, confirmatory testing, and you can actually obtain that testing anonymously if you go to one of our anonymous testing clinics. If you go to your doctor's office, you will be tested nominally, so it will be name-based testing, and that will be the laboratory testing that will happen. And as you know, if you do test HIV positive through the lab, then that information is shared with the local public health unit, and a public health nurse will likely follow up with you to ask if you've been able to access treatment and care, and to ask you to contact any known partners that may be at risk of HIV as well, so that they can come in and obtain testing. So I think there's that piece around sort of the privacy and anonymity that self-testing provides you, but obviously, you know, if you test positive, then you do have to obtain that confirmatory testing. It's very, very important, and then you will be most likely testing, you know, nominally. And then, sorry, I can't quite recall the last part of your question. I think that was, oh, so I would say the other piece, which I had mentioned, is the accessibility piece. So there may be situations where folks are living in rural and remote areas where they don't have immediate access to a testing facility, where we may not have an anonymous or rapid point of care testing site. And so they could purchase, especially if these are online mail order tests, they would be able to purchase those tests and obtain that testing if they are in a rural or in remote area. So I think, you know, also the reducing the barriers around access are very important. So I would say there's a privacy piece, and then the access piece. And I would say that, you know, as we see testing rates increase, and I think we will through self-testing, I think we'll see a reduction in the stigma associated with HIV testing and HIV.
So when do people should expect it to be rolled out? I mean, HIV self-testing.
Sorry, when should people expect to be able to obtain a test?
Yeah, when is it going to be rolled out?
Yeah, well, so as I had mentioned, it's already available for pre-order at the manufacturer's website, and I'll share that information with you. So folks can, in fact, purchase the test today. Now they won't, that's again, it's a pre-order. They won't get the test for another few weeks. If they're looking to obtain a test for free, they may be able to participate in one of the provincial studies that are underway that I mentioned. So I'll provide information on that. At this point, the Ontario government is not looking at developing, you know, a free of charge program. You know, it's possible that that may be something that develops down the road, but that's certainly not what we're looking at now. So folks would you know, be ordering the test themselves and purchasing the test, or participating in the two studies. I would say the other venue for you know, purchasing tests might be pharmacies. So we do anticipate that some pharmacies will make the test available for purchase in the coming weeks or months.
Thank you, Ken. But any other message around this? You have any other message?
Yeah, I would say that, and I really want to underscore the importance of this. So if a person thinks that they've been infected with HIV, they really should arrange testing right away. I think people thought that they needed to wait for weeks to months to have an HIV test if they thought they were infected. That's not the case anymore. If you think you are infected with HIV, then you should seek testing right away. And in fact, people can test as early as 3 weeks after they think they were infected. And if they test negative at that 3-week point, they will need to test again at about 6 weeks. And then if they're negative at that time, they should really test again at 3 months. And then that would be the final test for that particular incident that they are concerned about. You know, while they can test earlier and may in fact be tested positive as early as 3 weeks, if they are negative at 3 weeks and 6 weeks, they still need that third test at 3 months. But our messaging is, you know, test early and test frequently. test, within the window period as often as you feel, you can test, because we always know that it is better for people who are HIV positive to learn their status as early as possible and seek, that much needed treatment and care. I would also say, if someone takes regular HIV risks, they should consider taking HIV pre-exposure prophylaxis, or commonly referred to as PrEP. This is an HIV medication that they can use to protect them from HIV risk, and it's a medication they can take on a daily basis. There are private and public drug plans that will cover all or most of the cost of PrEP. And if a person would like to start PrEP, but they are not sure of how to pay for it, an Ontario program called PrEP Start provides 3 months of PrEP free for people who do not have a drug plan. The program allows people to start PrEP right away and gives them 3 months in order to find a drug plan that works for them. So I'll give you more information on that important PrEP Start program. And I also just want to be clear, though, that PrEP only protects people from HIV, not other STIs. So, people should still consider using condoms to protect themselves against other STIs. And if someone does not want to take PrEP, then they should consider other methods of reducing their HIV risk. And in fact, if folks do not want to take PrEP, they should also, along with finding other protective measures, they should test very regularly. And we would recommend that if they are taking frequent risks, they should test, about every 3 months. I mean, they should test right away after every risk event, but if that's maybe too often, then they should definitely test about every 3 months. And I would just end, and I'll send you a link by saying that there's a lot of information on HIV testing, very current information on HIV testing available at a website that we've just newly designed and updated. And so I will send you the link to that website for more information.
I look forward to seeing it.
Okay.
And I hope our community members will be taking advantage of this, added option of taking HIV testing. And as APAA, we'll be continuing to educate community members and introduce this HIV Self Testing. But thank you so much for taking the time speaking with APAA and educating our community members. So I wish you all the best. Thank you so much.
Thank you very much for the time. And Yohannes, it's always very important to be speaking about HIV testing and to be sharing information about HIV testing. So I'm happy to make myself available for future webinars or presentations and to share as much information as I can.
Thank you so much, Kate. I appreciate that.
Okay, thank you very much. Have a good evening.